Hello, I have chosen to look at chest physiotherapy as a method for airways clearance in patients with cystic fibrosis. I chose this topic as cardiothoracic physiotherapy is something that interests me, and I wanted to look into the evidence behind the airways clearance techniques that physiotherapists use. So just a bit of background. Cystic fibrosis is a genetic disease that affects the lungs predominantly and causes inflammation and infections. It results in the production of an excessive thick mucus, which can lead to airway obstruction and infections. If this mucus is not removed from the lung wall lining, then infections can occur underneath it because of the bacteria trapped, and also we get airway obstruction and difficulty breathing. So if it's not removed, it ends up exacerbating their condition and they generally end up in hospital. Chest physiotherapy is commonly prescribed to these patients to clear that excess mucus away, and generally patients with cystic fibrosis will engage in about an hour of chest physiotherapy daily just to clear that mucus and to lead a normal life. Chest physiotherapy is a combination of different techniques that are generally used collectively in order to clear airways. It can be subdivided into conventional chest physiotherapy and active clearance techniques. Conventional chest physiotherapy encompasses percussions, vibrations, huffing, coughing, and postural drainage. These techniques generally require a second party present, such as a physiotherapist, in order to aid the patient. Active clearance techniques involve forced expiratory technique, active cycle of breathing, positive expiratory pressure or PEP, oscillating PEP, and exercise. These techniques can be carried out independently by the patients and don't require any aid from a second party, which gives that patient independence and ownership over their condition and allows them to clear their airways by themselves in their own time. In order to research this topic, I went to Cochrane and looked at systematic reviews. I chose 3 of them. The first one looks at whether PEP is more or less effective than other chest physiotherapy methods in terms of clearing airways in patients with cystic fibrosis, and they found that PEP is not more or less effective than other airways clearance techniques. The second paper looked at whether chest physiotherapy versus no chest physiotherapy is more or less beneficial for these patients, and what they found was that in the short term, patients that received chest physiotherapy had more benefits over those that did not receive chest physiotherapy. And the last review looked at conventional chest physiotherapy compared to the active clearance techniques for these patients, and they found that conventional chest physiotherapy is not more or less effective than the active techniques. To review the quality of the evidence presented in the systematic reviews, I have divided them into the evidence into strengths and weaknesses. So starting with the strengths, firstly, the evidence presented in these reviews is in the form of systematic reviews. Systematic reviews are level 1 of evidence in the National Health and Medical Research Council evidence hierarchy. Systematic reviews analyse all relevant evidence from high-quality randomised controlled trials and condense the information into to come to an educated conclusion. Randomised controlled trials are the gold standard in clinical trial design. This means that the evidence used in these reviews is of the best quality on this particular subject. Randomised controlled trials take a group of patients that have the same condition, so in this case cystic fibrosis, and randomly allocate them to receive various treatments. This ensures the investigator that any differences between the outcomes of the treatment group and the control group are due to that treatment. Lastly, the selection criteria for these papers is also a strength. So the authors carried out electronic searches on 2 main databases, Group's Cystic Fibrosis Trials Registrar and Cochrane's Central Registrar of Controlled Trials. Relevant studies about airway clearance techniques, airways clearance in patients with cystic fibrosis were found, and then studies were then excluded if they were not randomized controlled trials, if there were too few participants, if the participants had other respiratory disorders other than cystic fibrosis, or if the control group treatment was unrelated to physiotherapy. However, the weaknesses in these systematic reviews limit the evidence about chest physiotherapy. The major limitation on the evidence for chest physiotherapy is that as of yet there is no long-term evidence. The majority of the studies conducted and reviewed were short-term. The study showed that chest physiotherapy, whether it be a collective method of chest physiotherapy or just PEP or just conventional methods on their own, does clear the mucus from these patients' airways, which is its overarching goal. However, more long-term research is required to determine the long-term benefits. It has been suggested that long-term randomized controlled trials for these patients are unethical, as we cannot restrict airways clearance, whether it be to just one method or to none at all, as these patients need that mucus constantly being removed, otherwise it will exacerbate their condition. In addition, the evidence is also limited as there is no consistency between the studies reviewed. The outcomes measured varied greatly between studies. Furthermore, the interventions given to the participants also varied greatly. This makes it really hard to pull the results from each individual study and come to a solid conclusion about the effectiveness of chest physiotherapy for these patients. Lastly, there was a large source of bias that was outlined in each review, and that was basically that there was a lack of blinding of both the physiotherapist and the patient. This is because it is extremely hard, if not impossible, to blind people in physiotherapy research, and this is because physiotherapy needs to be physically carried out on the patient by a qualified physiotherapist. So just to conclude on the evidence here, there is a lack of evidence to suggest that chest physiotherapy is an effective long-term method for airways clearance in cystic fibrosis patients. The lack of long-term studies has failed to provide a solid conclusion about the long-term benefit. However, this is not to say that chest physiotherapy is a poor method for airways clearance, because it's not. All the reviews have agreed that chest physiotherapy, whether it be just one method or on its own, or a combination of all the different techniques, does clear the mucus from the airways, which successfully treats CF in the short term. Clinically, chest physiotherapy is still widely used and it is a validated method for airways clearance in these patients. Physiotherapists, I would encourage physiotherapists to continue using this technique. However, they really need to evaluate their patient's own personal preference for airways clearance and also any contraindications for their particular patient in order to come up with a tailored program that suits their patient. So chest physiotherapy should continue to be used on cystic fibrosis patients that are willing to comply, as we know that it does effectively clear the mucus in the short term. However, more long-term studies does need to be done in order to assure that physiotherapists are working effectively in the long term in clearing that mucus. The lessons learnt from carrying out this review of the literature is that in general, evidence-based intervention is hard to come by in terms of physiotherapy, and this is because it is really difficult to blind people, as physiotherapy needs to physically be given as an intervention by a qualified physiotherapist that is going to know whether or not they are giving the treatment or the control. This means that we cannot say that chest physiotherapy is the best treatment for cystic fibrosis airways clearance, and other avenues do need to be explored. Thank you.